a frank discussion of what's going on right now. And although there are many, many concerns, I think Dan has found a clip that we'd like to show that's been done by Rutgers. And so if you'd like to introduce that, Dan, I'll line up the clip to show it.
Sure. So the chancellor of Rutgers, has some different campuses. They have New Brunswick is the main one, and Newark and Camden. Each of those has a chancellor. And then there's also a chancellor for biomedical and health sciences across the whole of Rutgers, separate. And the chancellor of Rutgers Biomedical and Health Sciences has been doing a series of roundtable discussions on various things. And he led one 2 weeks ago. The chancellor's name is Brian Strom. You may see a little thing of him in the upper right at some point. But he led a roundtable a couple of weeks ago on COVID-19 and inequalities, and specifically racial inequalities. So we're just going to show two parts of that. After these two parts, much of the roundtable dealt with internal things about how Rutgers Biomedical and Health Sciences could improve its medical education and respond internally to these disparities. That's not going to be of as much general interest. But these two background presentations I thought were valuable in terms of highlighting some of the key issues. So we're just going to look at those two. They take almost 12 minutes altogether. Henry Raymond does the first. I do not know him. The second one, the longer one, is by Denise Rogers, who whom I know slightly, not well. She was the interim president of what was then the University of Medicine and Dentistry of New Jersey in its last year or so before it merged in with Rutgers. So she's had some very high positions in the university. Anyway, so take it away.
So at this point, I'd like to turn it over to Henry to talk about specifically the COVID-19 pandemic and its implications and impact on disadvantaged populations. Henry?
Thank you, Chancellor Strom. Hi, everyone. I'm Henry Raymond. I don't think what I'm going to show you is going to be a big surprise. So let's just dive into it. So what you're seeing here are the population breakdown of New Jersey, all cases of COVID-19, hospitalizations, and deaths. The blue bar are the white population, red is Black African American, yellow is Latino. I think that's gray is Asian, and the greenish one is other. The point here is that while African Americans make up just 13% of New Jersey's population, they are 17%, 19%, and 18% of COVID cases, hospitalizations, and deaths. You also will see, in contrast, Asian New Jersey residents only make up 9.7% of the population, 5.8% of all cases, 5.4% of hospitalizations, and 5.7% of deaths. There is just a huge disparity in terms of the impact of COVID-19 on African American populations. So I have these two maps, and it's a little pop quiz. Who can tell me which one is COVID-19 and which one is HIV? Well, let me tell you, the one on the left is the per 100,000 case counts of HIV in New Jersey, and the one in the middle, or the one on the right, is the COVID-19 per 100,000 in New Jersey. So this last map is showing you the density of the African American population in New Jersey. I think it's pretty obviously a pattern that's being repeated, where we have dense populations of African Americans, we have dense COVID-19, and we have dense HIV. And my point here is that this is not unexpected. These and other public health issues, such as injection drug use, poverty, homelessness, follow these same patterns throughout New Jersey. This should be a wake-up call. This is irrefutable evidence that there is a pattern based on race.
At this point, I'd like to turn it over to Denise Rogers. Denise, again, is Vice Chancellor for Interprofessional Programs and Professor of Family Medicine and Community Health at Robert Wood Johnson Medical School. Denise?
Thank you, Brian. Next slide, please. So I want to start by showing this picture of George Floyd, the man whose death has really got us as a nation once again talking about issues of racial disparity. And in part, I show this picture to remind us all of George Floyd's humanity, so that we see him as a man, a human being, and not that image that so many of us have seen of him under the knee of that policeman. This is a human being with joys and problems and sadness and love, just like all others. And it's important that I point this out because very often in these types of situations, we forget the humanity of African Americans put in these situations and African Americans overall. Next slide, please. As Dr. Raymond pointed out, not only in New Jersey, but throughout the country, African Americans make up a larger share of the people dying from COVID-19. Next slide, please. I will briefly just reiterate what Dr. Raymond showed, which is this is the case in New Jersey as well, and point out that we have known about disparities in a variety of issues for decades in this country. Next slide, please. Here in New Jersey, we see that the average life expectancy for African Americans is the lowest, about 3 years less than whites and about 14 years less than Asians. African Americans also have the highest overall age-adjusted death rates by race, ethnicity in New Jersey. And I should add that African Americans die in disproportionately high numbers from 8 of the 10 leading causes of death in the state. Next slide, please. I show this slide to remind us that it's now pretty clear that social determinants of health account for, according to this slide, 40% and probably closer to 80%, since physical environment and health behaviors are also influenced by social determinants. And so the place in which people live and work and get educated all play a significant role in the health outcomes that we see in the United States. Next slide, please. I can never talk about health disparities in the United States without talking about the history of racism in the United States. Because without the historical context, it becomes too easy to believe that African Americans have these outcomes as a result of things that they have done to themselves or a lack of caring about health and the like. This is a view of racism of the past. Next slide, please. This is the racism of today. And obviously, again, the killing of George Floyd and so many others reiterate to us the significant adverse impact that racism has on African Americans. Next slide, please. One of the ways to help us understand the social determinants impact is to think about life in America as a game of Monopoly. And in this game of Monopoly, whites get to start playing at 2 o'clock, whereas African Americans don't get to start the game until an hour later. When whites start the game, they have the usual $1,500 compared to the $15 that blacks are given when they start the game. Obviously, African Americans are far more likely to get the go directly to jail card, and whites are far more likely to get the get out of jail free card. And what you will also notice is that the red lines are over Broadway and Park Place, as African Americans are not only not allowed to walk on those streets, but certainly they're not allowed to buy any property. Next slide, please. So one of the things we need to recognize is that a major contributor to wealth in this country is indeed property. And so if you're white and you live on Park Place or Broadway, your mortgage value is anywhere from $175 to $200. And obviously you get a lot of money if you have hotels on any of these properties, $1,500 to $2,000. Next slide, please. On the other hand, if you're African American, you live on Baltic Avenue or Mediterranean Avenue, and your mortgage value is $30, and the maximum rent you can even get with a hotel is $450 at most, and more likely on Mediterranean, you're only getting $250. Next slide, please. And what we know is that it's no accident that African Americans are more likely to live on Baltic Avenue and Mediterranean Avenue, because federal policies, along with local and state policies and decisions, have led to concentrated Black inner city poverty and white flight. Next slide, please. This article from Lancet from 2017 on structural racism and health inequities in the United States. Next slide, please. Tells us that residential segregation is associated with adverse birth outcomes, increased exposure to air pollutants, decreased longevity, increased risk of chronic disease, and increased rates of homicide and other crimes. And that's exactly what we see here in New Jersey, as well as the rest of the country. Next slide, please. If we look at the racial gap in wealth throughout the country, we see that on average, US median net wealth for whites is $127,390 and $8,050. However, if we pivot to New Jersey, we see an even greater, more stark gap in this wealth. We see that whites on average have a net wealth of $309,396 compared to $5,900 for African Americans. Next slide, please. We also see significant gaps in median household income here in New Jersey, obviously also contributing to adverse social determinants. Next slide. In New Jersey, as is the case in the rest of the country, African Americans are significantly more likely to live in poverty, 1 in 5 African Americans compared to less than 1 in 10 whites in the United States, and the same is the case for New Jersey. Next slide, please. Data also tells us that the adverse impact, economic impacts of COVID-19 will be disproportionately felt by the African American community. So not only are people more likely to become sick and die from COVID-19, but African Americans are significantly more likely to face the adverse economic impact. They're the first to be laid off, the last to be hired. And this will also contribute to then seeing higher rates of homelessness in African Americans as people lose their incomes and then are not able to pay their rent, with other results, including increased rates of hunger as well. We are beginning to get some inkling of that here in New Jersey, and we'll see more and more over time. Next slide, please. And so in summary, what I want to remind us of is that equality is not enough. We have to strive for equity, and equity means that those who have been disadvantaged over time will need to get more just to catch up. But it is imperative that we pay attention to reality, because the obstacles that have to be overcome by many in the African American community in order to deal with pandemics such as COVID-19, as well as disparity in other chronic illnesses, means that we have much, much more work to do, not only here in New Jersey, but is in the country as a whole. Thank you.
Okay, so that was the 2 sections that Dan had earmarked to show, and sobering 2 sections they were. So Dan, over to you to start off the discussion.
Sure. I'd like to actually flesh out a few of those points that were discussed. One of them is, hold on. One of them is that if you look at some of the specific factors that disproportionately affect the African American population, you'll see that, for instance, Black people are much more likely to be unemployed as a result of the COVID-19 epidemic. So you're starting from a worse place in terms of health disparities, and then you're piling on top of that a higher level of COVID-19 related unemployment, but that for those who are actually employed, they're much more likely to be working in positions that are that are so-called essential positions, and that therefore may be more subject to on-the-job transmission of disease. So for instance, just to show a few figures on this point, let me see if I can share my screen here. The Economic Policy Institute did one among many, many valuable articles on this subject. And if I do this right, you should in a moment be able to see. So this is a graph. Let me see if I can blow this up a little bit. That's better. So this is a graph stratified by educational level of Black unemployment compared to white unemployment. And as you can see, at every level, this is overall, and this is less than high school, some college, bachelor's degree, and advanced degree. At every level, Black unemployment is higher to begin with. By the way, this is from an item from the Economic Policy Institute, which is a think tank that does a lot of valuable research, and they're based in Washington. And in fact, as you can see, the unemployment rate among Blacks with a bachelor's degree is higher than the unemployment rate among whites with less than a full college education. The unemployment rate among Blacks with some college education is higher than the unemployment rate among whites with only a high school education. By the way, these are non-Hispanic whites, and the racial/ethnic categories, this is based on the census, are those who refer to themselves as Black or African American alone. Furthermore, let me just scroll down to, this is wage gaps. I didn't want to look at wage gaps. Benefits gaps, paid sick days. 2/3 of whites have paid sick days, less than 60% of Blacks. Ability to work from home, nearly 30% of whites can, fewer than 20% of Blacks have jobs that allow them to work at home. Again, emphasizing this criticality of the fact that Blacks are more concentrated in industries and jobs where they have to work in person. Again, increasing the risk of transmission. What I was looking for here was, this is share of households with multiple earners. By the way, just on the wealth disparities that Dr. Rogers talked about, these are nationwide figures, and these graphs do not include housing. So, you know, the biggest wealth holding that most people have, are homeowners, is their house. This is just cash reserves, okay? And stratified by, here by whether or not people are college educated, here by whether or not people are homeowners. And again, this does not include the value of the home. The light blue is cash reserves held by whites. The black is, the dark blue is held by Blacks. So just in cash reserves alone, there are huge disparities here. And one of the effects of that in terms of the economics, and this goes back to what Dr. Rogers was talking about when she referred to that article from Vox about how the recession for Blacks is going to be a depression. Blacks, on average, have much, much less in the way of financial reserves, and they're much less likely to be able to endure a period of prolonged unemployment because of that. Now, there are plenty of white people in that same situation, and we shouldn't lose sight of that, but this is disproportionately concentrated in the Black community. You know, I'm reminded Dick Gregory 50 years ago or so said something, there was some economic report that said something about there may be a need for belt tightening. And his comment was, yeah, and you know who the first notch is going to be. And this is unfortunately all too true. Another factor that, again, to flesh out some of what's going on here is that when you look at pre-existing conditions, chronic illnesses, these disproportionately affect African Americans compared to whites. And so whether it's asthma, diabetes, hypertension, or obesity, all of which are risk factors for severe COVID-19 illness if one is infected. I don't recall if they changed the actual probability of getting infection, but they certainly increase the risk of severe illness if one is infected. All of these are higher among African Americans. And if you look at rates of people who are not insured, African Americans are more likely to be uninsured than whites, as of the latest data available from the Census Bureau, the 2018 American Community Survey. So, you know, this piles up one thing on another to contribute to these disparities. And again, I want to focus on the fact that one more, denser housing. Okay, poor people in general, especially poor people in urban areas, are going to live in more densely concentrated housing. Well, if you look at people who live in single unit housing, a much greater fraction of white people live in single unit housing, about 3/4, just over half of African Americans do. 2 to 4 units, about 1 in 8 African Americans live in 2 to 4 unit housing. That's about 1 in 6% is about what, 1 in 15 less than that of whites. And if you look at people who live in 5 or more unit housing buildings, nearly a third of blacks do, only about 1 in 7 whites do. So again, there's a concentration, there's a tendency for African Americans to be in areas which are more densely concentrated in terms of housing. And I could go on and on. I'll post a link to this so people can actually refer to it later. There was one other graph in here that I wanted to get my hands on. This was the bare numbers on COVID-19 deaths. Yes, this was what I wanted to get. Earlier, I had spoken about a tendency for African Americans to be more concentrated in frontline jobs that are essential, where people are on the front lines, where transmission on the job is much more likely. So again, if you look here, these are percentages of each of these who are African American. So among frontline workers in general, about 1 in 6. Among all workers, it's only about 1 in 8 who are black. And if you look by industry, the percentage who are black in each industry, grocery, convenience, and drugstore workers, 14%. That's greater than the percentage of blacks in the population. Public transit workers, 26% of public transit workers, a little over a quarter, are African American. Trucking, warehouse, and postal service, a little over 1/6, they're African American. And again, these are out of proportion to the numbers in the population. Healthcare workers, just about 1 in 6. Childcare and social service workers, nearly 1 in 5. And again, these are disproportionate to the numbers in the population. So there's a concentration of African Americans in industries where they're much more likely to be exposed to illness, to contagion and transmission. One other key set of statistics that I wanted to highlight is, and let me see if it's on our next screen here. I have several of these. So the CDC publishes every week something called the Morbidity and Mortality Weekly Report, MMWR, as it's known to epidemiologists. And MMWR has articles every week on some key epidemiologic things going on. This is publicly available, by the way. This is not behind a paywall. It's a US government publication. It's often technical and medical, but it's often a great source of information on health disparities. So one of the key things that's been going on in the COVID-19 pandemic, especially, at least in the United States, I don't know what this looks like in other countries, is if you look at the age of people who die, right? We all have heard, most of us have heard, that older people are more likely to die of COVID-19 than younger people. And in fact, if you do a graph by age versus probability of dying when you're infected, the graph goes up like that as age goes, as age increases. However, if you stratify by race and ethnicity, and you look at just what proportion of deaths are in people under 65, you'll see that that's much higher among Blacks and to a lesser extent among Latinos. So let me flesh out what this graph means here. So let's see. This is the proportion of deaths among people who are the proportion of COVID-19 deaths among people who are less than 65. And the white bar is Hispanics and Latinos. The light bar is non-white, non-Hispanic, which is virtually all Black in this country. The intermediate blue bar is white, non-Hispanics, and the dark blue is race and ethnicity unknown. So among those who are less than 65, if you just look at this light blue bar, which is Blacks, you'll see that the proportion who are Black is much higher here than it is than the proportion who are white. And when you go over to 65 to 74, this gets more even when you get up to 75 to 84, and even more when you get to greater than or equal to 85. The percent of deaths is highest among whites. So there's this age discrepancy that's going on. And if I remember which things I pulled up, let's go to here. There was, I lost what I was actually looking for. There was a nice graph that I found that showed, which I thought I had up here somewhere, but maybe I don't. Okay. Oh, yes, here it is. Okay. So this is from the Brookings Institute. Again, hardly a radical outfit. The Brookings Institute had this nice article saying race gaps in COVID-19 deaths are even bigger than they appear. They took that report from the CDC and they simply fleshed it out in a different way. And here we see COVID-19 death rates by age and race. The orange bars are Black, the light gray are Hispanic and Latino. And if you look at it this way, as you can see, as you go up, the rates among Blacks are higher, but even at the younger ages, they're higher, even though they're relatively low. And if you look at the ratio of rates between Blacks and others, so if you take white as your baseline rate in each age group, and you look at the ratio of the rates in the other groups to the rates in whites, you'll see that the death rate among Blacks at 35 to 44 years is 10 times, this is the ratio, is 10 times the rate in whites. Among 45 to 54-year-olds, it's 7 times the rate in whites. Among 55 to 64-year-olds, it's 6 times the rate in whites. 65 to 74, 5 times. 75 to 84, 4 times. And 85 and above, twice the rate in whites. So there's a disproportionate effect among younger people, and you have similar but not quite as dramatic things going on with Hispanics in terms of disparities in death rates. And this Brookings article goes into a number of the issues that underlie these, which I've already discussed. So when you actually look at some of these data, you see when you start to look at it more closely, you see just how dramatic some of these disparities are. I'm going to stop now. I have some other points to make, but I'd like to, let's open this up a bit. By the way, I will share the links to these and some other articles as well after we're done.
Thanks, Dan. There's a couple of questions. Janet and Peter say, what about Asians? Because they weren't on those charts for the most part. Did you have any information about that?
Yeah, so one of the questions that's going on is that it looks like in New Jersey, Asians are actually underrepresented among those who are being infected and dying. It's not clear what's going on here. First of all, the data are sparse. Second of all, Asians as a category is an absurdly broad category. It's half the world's population being lumped into this one, quote, racial group. So I'm always very suspicious of that. And plus, if you look at the social and economic status of Asians in the United States, it's very mixed. I mean, you know, you have huge pockets of poverty, let's say, in concentrated urban areas in some of the Chinatowns, and then you have pockets of relative affluence in Bergen County, for instance. And it's certainly not among all Asians, but among some parts of the Asian community. So, and so it's this kind of generalization, counting Asians as one group, I think is flawed, and that's putting it kindly. And again, the data are sparse, so it's hard to say. It's hard to generalize in terms of what's going on with respect to Asians in general.
So yeah, let's open this up for discussion. So as before, either raise your hand physically or raise your hand virtually using the participants window. I see Pam already has her hand raised, so go ahead, Pam.
Thank you, Dan, for all that phenomenal information, and thank you for hosting with Dan this morning, Anne. I want to just make a comment and then make the comment towards asking a question of Dan. So, Dan, we know that they've been saying for a long time that there is a higher rate among the Blacks for getting COVID. But if you notice, when they show pictures of people who have passed on from COVID, they're showing pictures of Black people who are quite overweight or have suffered from high blood pressure, all the diseases and problems that COVID actually attacks. The disparity is, why is it that Blacks are so much more uneducated, and they, in other words, they tend to eat poorly and they tend to receive poor education when they start out, they're equal. Why does that happen? Can
I just jump in there and say that, as we're seeing and becoming more and more aware, there really is such a large amount of systemic racism from the get-go, as the presentation from Rutgers University showed. A lot of these health disparities are caused by growing up in poverty with lack of opportunity. And that is obviously proportionately much higher amongst the African American population. So I think that's why we're not all born equal. And I think, for those of us that still think that, we're kidding ourselves. Black people, as the presenter from Rutgers said, they start the game an hour later than everybody else, right? If you take the Monopoly board analogy, they start from a position of not having as much as most of their white counterparts.
Mhm.
Yeah,
Is there a way that we can educate them better, maybe as a group, to go out and as ethical tourists and, get groups together and better educate them?
so the issue isn't necessarily one of education. First of all, if you look at obesity in this country, you find that it's actually rather correlated with poverty. And of course, for those of us who grew up in a certain era when the biggest problem of the poor was being underfed, if you look both globally and in the United States, obesity is in fact increasingly a problem of the poor. Um, and it doesn't seem to be because the poor don't know how to eat, it's because of what kind of food is available to the poor easily and cheaply. Um, Organic kale is expensive. Um, Factory farmed fatty hamburger meat is cheap. And our price structures make things look like that. So it becomes very difficult for people whose incomes are limited to adopt the kinds of diets that would make it easier to maintain a healthy weight. Furthermore, if you live in a densely populated poor neighborhood with high crime rates, the safety of going out and running or walking may not be what it is if you live in a well-to-do suburb where street crime rates are low. And if you talk to people who live in densely populated poor neighborhoods, they may say, I don't let my kids go running out here because the streets aren't safe enough. So none of which is to downplay the criticality of racism, nor, and I just want to make it clear, racists will often justify, the problem is black on black crime. Well, the fact is every poor community, when you concentrate them in one big urban area, has high crime rates. I mean, Jews did in the Lower East Side, Italians did in Little Italy when they were all concentrated. So whenever you have a large poor community concentrated in a densely populated area, street crime becomes an issue. This is not something unique to Black people. But because you have that kind of a geographic situation, it becomes much more challenging to get the kind of level of physical activity that one would like. So opportunities for physical activity are more limited, dietary choices are more limited, and my feeling is that before we start attributing things to either ignorance or lack of concern about health, if we could equalize the opportunities to have healthy diets and opportunities for physical activity, and then see if there are still any residual effects. And by the way, that goes, the same thing goes for poor whites, because in this country things are so racially categorized. It's appropriate to see those effects by racial lines, but you see those same effects in poor white communities as well. Obesity rates in Appalachia are very high. Obesity rates even in poor white communities outside of Appalachia, likewise. So this is not something that's unique to the Black community. It's more concentrated in the Black community because Blacks as a racial group, and again, that's how this country views people, are more likely to be in that kind of social and economic situation. And by the way, there was a nice piece in the New England Journal of Medicine, it's publicly available, it's not behind their paywall, that says, let's look at the racial and ethnic disparities that are out there in terms of the Black population in particular, and let's be careful not to think of them as somehow intrinsic to or essential to being Black. Let's look at the determinants of what makes life in Black communities harder than it is in white communities, as our first source of explanation for those. And again, I'll post a link to that article as well. It's sort of a cautionary note about how we should look at the racial disparities in COVID-19. A nicely written one too.
So there are some good comments in the group chat if people can take a look there, and then I will go to Joe.
Okay.
There's a couple of things that came in before Joe raised his hand. One from Peter Rosen about whether there's a goal setting issue, a lack of setting high goals for themselves. And that's the reason that African Americans don't get ahead. I think it's a little bit more complicated than that, but I think
motivation. I was thinking motivation.
Motivation. Well, you know, when society tells you you can't get on, it's a difficult thing to fight against that, right? So I guess it does boil down to the systemic racism from the get-go. And Christina makes a good point about food deserts, which are also contributing to poorer health in lower income communities. And that's where individuals that don't have cars have to go to local stores that often don't have good quality food. So that's that. So Joe, you had
okay. Yeah, Dan, thanks so much for this very lucid analysis of the dislocations in data with regard to the African American community. Of course, COVID-19 is both a phenomenon going on at the moment that has its impact, but it's also revealed these extraordinary dislocations that have existed well prior to COVID-19 that are aggravated by the pandemic. And all of it, of course, raises the question, I think, of how we move ahead after the plague is over. We're in a time, hopefully, of extraordinary social transition where society will be able to, my hope is, and everybody's hope is, will be able to redress the systemic racism that exists in so many interlocking, reinforcing ways, as you've demonstrated. Education, housing, wealth, and so on are all, one doesn't know where to begin. But given that case, I'm wondering whether there have been studies with regard to the class issue in terms of African Americans. We tend to stereotype, I think many of us, the Black community as being exclusively poor, and yet the middle class Black community is now larger than the impoverished sector. I mean, the Great Society of the 1960s did indeed advance many Blacks into the middle class. I remember an article years ago, I grew up in Queens, so it caught my attention. There was an article in the paper about how the average income of African Americans in Queens was actually larger than the average income in the borough as a whole, and Queens has now and then 2 million people. There are large sectors of Queens, Ozone Park, St. Albans, and so on and so forth, where you have middle class Blacks, albeit perhaps lower middle class, working for municipal government as in transit, in the police force, fire departments, and so on and so forth, whose incomes were stable and very good and remain so. Those people, unfortunately, are on the front lines now in more dangerous occupations. But the question I'm asking, Dan, does indeed the class factor give us, with regard to African Americans, give us a clue as to how indeed to attack the question of systemic racism once the air clears, and hopefully society will move in a more progressive or I should say anti-racist direction, assuming it does? That's the question, complex question, which I'm sure yields complex answers. But I'm looking at the class factor and clues for how to move ahead.
Right. So first of all, that actually leads to another critical point that needs to be looked at, and it's sort of one of the key action points that's necessary for us as a society, and that is that the data that are being collected on COVID-19 infection are full of holes. So first of all, not every place collects data on race and ethnicity. Second of all, almost nobody collects data on socioeconomic status, indicators of socioeconomic status, such as income, education, et cetera, among those who are infected. So it becomes very, very difficult to drill down to the kind of data that would help to illuminate exactly those kinds of questions. Another factor, by the way, that contributes to the racial disparities, this isn't directly related to what you were saying, is that because this started in the cities where the face of poverty is even more predominantly people of color than in other cities where the face of poverty may have a larger white component, it makes the fraction of Black people who are affected that much greater. In other words, if this had started in cities where there are a greater proportion of poor white people, we might not see as high a racial disparity. But this started on the coasts where the face of poverty in this whole country is disproportionately, not majority, but disproportionately people of color. But that's particularly true in the large cities on the coast, which is where this started. It's also true, of course, in the old large industrial cities in the Midwest, and these disparities are presumably showing up there. I actually haven't seen figures from there, but what you're pointing to is a huge gap in data. And so one of the things there are a couple of nice articles actually that I can point to that raise exactly this issue of we don't have enough data. Now, there are some projects that are looking at COVID-19, drilling down to as granular a level as one can get, whether down certainly to zip code, and I think in a few cases they may even be able to get down to census tracts, which are very small. A census tract is on the order of, if I remember right, it's like 5,000 or 6,000 people. And that can help somewhat because census tracts are going to tend to be more uniform within a census tract in terms of income level. And that becomes more and more true in this country as housing becomes more and more segregated by socioeconomic status as well as by race. But still, these data are sparse. And that, by the way, raises yet another issue in terms of disparities that I didn't mention earlier. Testing for COVID-19 is, this may be changing certainly in our area, but in many places, testing for COVID-19 is much less available in poor and minority communities than it is in wealthier communities. So how are people even going to know if they are infected, and how are you going to do contact tracing when the testing is simply not as good in some of the poorer areas? You know, again, the disparities in the delivery of healthcare. Forget the outcomes. Just let's look at the delivery of healthcare, and I'm including testing as part of the delivery of healthcare. In turn, affect the transmission of an epidemic disease simply because you don't even know who's infected some of the time. So these holes in the data, both in terms of testing and in terms of collecting information about people who are infected, are a big problem in terms of getting at exactly some of the questions that Joe has mentioned. The other point that I would raise just in response to, I guess it was Peter's question in the chat, was whether there's a disparity in setting high goals for themselves. And I'm kind of amused by that question because it has been a stereotype of the poor going back to, and you may know your English history better than I do, but writers on poverty, you can go back centuries, always claim that, well, the poor just aren't as well motivated, so they sort of deserve to be poor. And in fact, you can find counterexample after counterexample to that. And what is often interpreted as not setting goals may be an inability to achieve high goals because society prohibits it. So whether you look at housing, whether you look at continued, not just past, continued discrimination in hiring, and there have been any number of studies that show that, whether you look at the lack of wealth that makes it impossible to even set those higher goals. And again, if you look at the history of housing discrimination in this country, which has prohibited Blacks from developing that huge source of wealth, namely home ownership, in amounts grossly disproportionate to their numbers, and then you say, well, why don't they just go and use, and borrow money to buy a house? Or why don't they? Well, because they can't, because they don't have credit ratings that let them do that if they're living in poor communities. So this, you know, this tendency to say lack of setting high goals for themselves is a way in which poor people have been characterized throughout history. And you know, any good sociologist can tell you that that's not really an accurate characterization. It's putting the cause, it's interchanging cause and effect.
Okay, thanks, Dan. So I thought I saw Linda's hand up a little while ago, and then it went down again, but she was first, followed by Laszlo and Edna, and then followed by Diane Kozarski. So Linda, over to you first.
Okay. This goes along with what Dan said and what Peter said. I put into the chat about 40 Acres, the program on the media, which is so excellent. And Peter Koustaras has seen it and also seconds that. But here's examples that we were never taught this. This is what we never learned. And I heartily recommend Peter and all of you to listen to this because it's very approachable, very reasonable. 40 acres and a mule is what was promised to the freed slaves by, I think it was General Sherman. He asked them what they wanted. And so he designated a spot of land that freed slaves could have, and they would get a mule. The Southerners completely prevented it. Okay, and the broken promises go from there. But she starts, interestingly, at this end, the coming tsunami of evictions that is starting and is going to overwhelm us if we don't get people in money in their hands to stay. And one of the interesting things is that she said, okay, somebody loses their rental and then things stabilize and they're looking for an apartment. So they looked at Milwaukee and said, okay, in a really bad neighborhood, this size apartment would run for $600 a month. What would they need to spend to get into a better neighborhood? Anybody want to take a guess? $650 a month. So why aren't they moving? Do they just want to hang where they grew up, where they know the neighborhood and so on? No, they can't. They cannot get the apartments. They can't get the financing. In every step of the way, they're locked out. And that's the reason why it's not that they don't have ambition to do better, but they're stopped at every turn. And Brooke Gladstone goes back to GI Bill and what it did for the US after World War II. Did it apply to Blacks? No. And it was baked into federal law that you could not give any of this money to Black soldiers and so on. All down the line into the 1960s, this was part of the federal law. So I strongly urge you, listen to it. I actually think this is a 4-part series. I want to go back and listen to the podcast of the first part. But the second one, I think, is still going to be on the radio this afternoon. I don't know whether it's at 8:20 a.m. or 93.9 FM. But it's absolutely brilliant. She not only is interviewing people, but she's using people's own words from what was written at various times, what they said and why they said it and so on. But it was like, I never learned this stuff. I never knew this stuff. And believe me, my school years are way back, but you know what? I've never stopped reading and learning all these years. I didn't know it. I hear about systemic racism, but I didn't know the details of what it meant. Now I do.
Yeah, just thank you, Linda. Just if you wanted to get to On the Media, I'm pretty sure that On the Media is kept posted indefinitely, as a matter of fact, on the media website. So even if you don't hear it on the radio today, or if you didn't hear earlier,
It's on the podcast. You can get it.
no, right, exactly. And so those are available. You can get on the media back years if you know.
Yeah, it's a WNYC award-winning program. Okay,
Right.
let me shut myself down.
Okay, thanks, Linda. On to Laszlo and Edna now.
First, just a small point. Even in middle-class Queens, many of the areas where African Americans bought homes has white flights, so their property values are lower than comparable homes in white middle-class areas. Actually, my daughter does some work on the education and admissions to college, and so lots of things about that go into middle-class property values that affects African Americans. Number two is there is a book by Ibram X. Kendi that I constantly recommend nowadays because it goes into very much into more on the subjective side, not as much statistics, but the divisions and different aspects of racism and how to, even within the African American community, like these ideas that we just talked about, do they, why don't have the aspirations like, that somebody mentioned before about why don't they grab the available opportunities that's raised by white conservatives very often as a response to when there are some programs that were supposed to assist some aspects of inequality. So Ibram X. Kendi's book is very good, and it's qualitative, but it's personal, but I think it gives some response to some of the questions that we're facing. And the third is I feel verified with for myself there's an opening, I think, in this country. I have to look at it positively, that the movement that is being formed is basically opened up a floodgate of information and awareness, and even for people like myself, who was engaged and involved and demonstrated for the last all kinds of issues of racism for the last 50 years, and still hasn't been, and it's being integrated, I think, into the consciousness of many people, and hopefully we'll make our efforts more effective to change things.
Thank you. Excellent. Diane Kozarski, and then I think Joe also raised his hand.
This occurred to me, Dan, while you were going over the spotty quality of the medical statistics. Do you have any sense, or is anyone tracking methodically the attempts of Republican governments to suppress information like death certificates and that kind of coverage, just because they don't want to expose how awful it is in under their government aegis?
I didn't come across anything like that, which doesn't mean it's not going on. But one thing I did note in a couple of the articles that were talking about some of the disparities, and for people in some states, it's a critical action point, is the fact that some governors have refused to accept Medicaid, and this goes back, the expansion of Medicaid under the Affordable Care Act has made it that much harder for poor people, and again, poor people are disproportionately people of color in those states, to get health insurance. So in those states, they're going to be particularly, because of the concentration of Blacks and Latinos among poor people, that's going to heighten the racial disparities in those states. And in fact, one of the proposals that's out there is an expansion of ACA Medicaid coverage to all states, whether they want it or not, as something that, as an action point that can be taken on nationally. There's another, by the way, more subtle point on that's sort of the global. Another point in terms of disparities, and that is selective enforcement or misenforcement of the rules about wearing masks in public where that's been required. There seems to be some evidence that Black people are disproportionately harassed by police for not wearing masks in public. Now, look, everybody should be wearing masks where they can't stay, far apart from everyone else. I'm not making excuses for anybody, but if enforcement of that is going to be done in a disparate way, it's certainly not going to increase anyone's willingness to or willingness of people who are on the receiving end of racism in this country to obey those rules if it is perceived as just another way of engaging in racist enforcement. So from a public health point of view, it's stupid to enforce those rules in a discriminatory way. The other issue that comes up, by the way, is that, of course, being masked has historically been viewed as something that just criminals do. And so now you're in this bizarre situation where the dark-skinned face is regarded by many people before anything else as a criminal face. Now you're telling everyone to wear masks, but that's heightening in the eyes of some a certain image. And so you get into some very complex issues of how the implications of the necessity of wearing masks gets played out against the backdrop of racial stereotypes in the United States.
Joe.
Yeah, okay, one quick point and then a question for Dan or anyone else who may know the answer to this. I would recommend to everybody that they read that phenomenal article by Ta-Nehisi Coates that was in The Atlantic several years ago. It's the longest article they've ever had. It's 60 pages long. It's an analysis of systemic racism, and he focuses primarily on discrimination in housing and looks at the history of Blacks as the history of plunder, in effect. It's a brilliant analysis, which brings me to housing. And it's a question that brings it right home to Bergen County. And I should know the answer to this, but I don't. We founded the Fair Housing Council of Bergen County in the 1950s, and Lee Porter was the executive director. 60 years later, Lee Porter is still the executive director and fighting these battles. And although Bergen County demographically has changed in terms of lots of immigrants in the county that have moved in, it's amazing to me that when it comes to African Americans, we are almost exactly where we were when the Fair Housing Council was founded in the 1950s. Out of 70 communities, you will find African Americans in only 3, namely Teaneck, Hackensack, and Englewood, with a sprinkling a little bit in Ridgewood and Westwood, and virtually nowhere else. Now, clearly, blatant racism is still with us. Lee still hires testers, as some of our members used to be, to go in to test against what in effect is blatant bigotry. But I'm wondering, Dan, if you or anyone else have any thoughts as to why indeed this county, our county, basically has been so static with regard to the movement of African Americans into the other 67 communities that make up this middle class, essentially middle class county. Do you have any thoughts about that?
I don't, but I did come across one thing, which was of all of the, in one of the articles I was reading, of all of the metropolitan area, the major metropolitan areas in the country, the most segregated, as measured by the proportion of Black people who would have to move in order to equalize the housing across neighborhoods. The most segregated is Milwaukee. The second most segregated major metropolitan area is the greater New York metropolitan area. It is not Chicago. It is not St. Louis. And we know how atrociously segregated those areas are. Those get the national reputation. In fact, the New York City metropolitan area is the second most after Milwaukee by that measure. So whether the issues in Bergen County are specific to the county or are more general, I don't know, and I suspect that's
Good point. Yeah. Right, and New Jersey has among the most segregated schools in the United
Yes,
States.
that's right.
That's right.
Complex is not an excuse for inaction, but it, you know, again, I just don't know, and I think, you know, it's a sort of a critical thing to study, both in the whole metro area and in Bergen County in particular.
Well, I certainly know with local municipalities, when it comes to building affordable housing, they obviously this has to be approved by the town councils in the various municipalities, and they will often approve low-income housing specifically for seniors and veterans, never for low-income people, you know, in general. So it's, I mean, and that also makes it more difficult for, you know, more of a spread equally amongst all the diverse populations, because the towns, there are acceptable poor people, acceptable low income housing, right? And I see that at every town level when they put up these affordable housing units.
Yeah, and by the way, if you want to see that played out to the level of absurdity, just follow the infighting and virtual civil war in the municipal government in Englewood Cliffs over the building of affordable housing on the old Unilever site on Route 9W, which is, I mean, I don't live there, and I read these articles about, you know, the mayor and the council practically coming to blows and them suing each other. As it's as I say, it reaches the point of absurdity. Yeah.
Okay, so I'm not exactly sure how long these platforms are going to run, how long we give for questions, but this is usually about the time, I think, right? At about 12:15 when things pop up, unless anybody has anything pressing they want to add to the conversation, which is excellent. And if you haven't checked the group chat, please do so if you can do that on your computer, and take a look at all these excellent resources that people are sharing on there as well. Is there a way of saving this chat? I don't think so.
You know, there is.
Yes, you can. So if anybody wants to save these resources, if you go to the Zoom group chat function, at the bottom there will be a to window where it should say everyone and a little down arrow. And to the right of that, there are 3 little dots. If you hover your mouse over the little dots, you will then see a save chat button. And if you press that, it will save the chat to your computer. So you have all those lovely resources that you can look at later. I've got a thumbs up, so great. It worked for somebody. Thanks, Sylvia.